Lung auscultation. When auscultating the posterior chest, ask your patient to bend her head forward and fold her arms in front. This will move the scapula laterally and bring you closer to the chest wall. Lung auscultation should always be performed with the stethoscope on bare skin. Ask the patient to breathe deeply in and out through their mouth to eliminate sinus sounds. Listen fully through both inhalation and exhalation. Always listen systematically from side to side in a minimum of 10 points, at least 4 in the front, 4 in the back, and 2 in the axilla for the right middle lobe and the lingula. When auscultating the anterior chest, have the patient sit upright. If necessary, you may ask your patient to lift her breast to facilitate auscultation.